Our tradition at Noyes Health has always been to provide the finest health care to residents of our service area. Over 14,000 patients annually come through the hospital's emergency department in Dansville. The After Hours Care Center in Geneseo sees about 7,000 patients annually. For most of us, we don't know what's available in our community hospital until we need it. There are many services here at Noyes Health that people are probably not aware of. In addition to the hospital, Noyes Health has a mental health outpatient clinic on Main Street in Dansville. One of the highlights each year is a mental health art show and exhibit. In Geneseo, there are 2 sites. Noyes Health Services Building is on East South Street and includes space for ambulatory surgery, physical therapy, radiology, and lab, as well as multiple physician offices. Also in Geneseo, on Millennium Drive, is a kidney disease and dialysis unit, serving the needs of patients who need dialysis treatment. And very popular in both Dansville and Geneseo, we have our after-hours urgent care services, which are an additional alternative to the emergency department. And we offer throughout our service region multiple community wellness programs such as Lifeline, Noyes First Steps, and diabetes education. Our vision at Noyes Health is to be our community's first choice and primary resource for medical care and wellness promotion.
Dealing with people as a whole, I think, is a skill that many nurses may not realize that they're going to need, but they absolutely do need. Caring for patients is important, that the small things are important, that it isn't all about what surgery they're going to get or what grand medical problem we're going to fix. It's about caring for people as a whole. Dealing with family is a top priority, making sure that they know what's going on with their loved one, keeping them informed, finding out what comforts that they need, because at Noyes, we treat our patients like they're family.
We are building a brand new emergency room, and we're going to go from about 3,000 square feet to 10,000 square feet. Our original ED was built at a time back in the 70s when workflow was different, volume was different, equipment was different. And so now we have to expand into space that really meets all of those workflow and patient privacy and comfort needs. We really have to think how care is given outside the walls of the hospital as we go into the future. That traditional way of taking care of patients is changing so that a hospital or a system that delivers care now has to do that in what are non-traditional ways. From providing the majority of our care within the walls of the hospital to providing that care including the patient's home and in conjunction with other community agencies.